This is the Doctor Marketing Tips Podcast. I'm your guest host today, Keith Landry. We've got an exciting podcast for you today with a lot of information on how business owners and managers of medical practices can really improve the efficiency of their operations. And we've got a national expert on this, Dr. Steve Vargo, who started his career as an optometrist practicing and then made the switch over as a business consultant to medical practices. Great to have you here with us today.
Thanks, Keith. It's great to be here. Thanks for having me.
It's going to be fun to get some of the insights from you on how our managers of medical practices can improve what they're doing these days, especially in a time of change. So let's start with a little story with you, Steve. You went to college. You went to the Illinois College of Optometry, and you got your Doctor of Optometry degree, and you started practicing. And then about 6 years in, you realized, wait a minute, this might not be exactly what I want to do. Tell us about that.
Yeah, I think that's about right. So I always had an interest in the medical field and the clinical aspects of that, but I also had a lot of interest in the business side of things as well. And I think that I was somewhat unique in that way because I think a lot of doctors, especially in my field, the ones who operate their own practices, a lot of them feel that that's a necessary evil, right? Mm-hmm. Dealing with the finances and dealing with staff management. And I always liked that. And I actually found out a number of years in that I actually enjoyed the business side of it more than the clinical side. So I went and got an MBA and just really started developing that business side of things. And it was about 15 years in when I made the transition from practice over to practice management consultant. So that's where I work now. I work with private practice owners on the helping them with the business side of their practices.
So how did seeing practices most intensively for the first 6 years and then for another 9, how did that make you a better consultant to folks who are running practices?
Yeah, well, I mean, I think working in the field, obviously, you deal with a lot of those challenges. I will tell you that when I first started consulting, I thought I knew a lot more than I really did. And I had some mentors, so that when I transitioned over to this job, I didn't do any consulting for at least 3 months, and I just worked under some of the top guys in my field, really renowned experts on the practice management side. And wow, what an education that was. But I remember thinking early on, I don't know nearly as much as I thought I did. So I think I've gained the most knowledge working now has it been 5 years in the business side and just working with so many practices and things that seem so, I wouldn't have had the answers early on. You start to see these challenges pop up over and over, and then you start to recognize the answer. Very similar to practicing optometry or really probably any medical field. When you first get out there, you're seeing a lot of conditions for the first time. It's a much different experience for a doctor who's been working for several years and is accustomed to seeing that condition. So I just think through time, you start to really absorb a lot of that knowledge and how to deal with different situations.
And that's where gray hair actually becomes valuable.
I'm getting there. Yeah.
Let's talk just for a second about IDOC.net. You work for a company called IDOC.net, and that's sort of the platform and the system with which you work. Just explain that very briefly so our podcast listeners understand how that model works.
Sure. So when I originally started doing this, I worked for a company called Prima I Group, and we were primarily a business consulting group. And then we were bought by IDOC, who was what we call an eye care alliance. So, their core function was probably getting members discounts and rebates for doctors who own their own practice. So you would join our organization, you would join IDOC to get better deals through economies of scale. And they built that model up. They wanted to add a consulting arm, so that's where they bought the group I was with at the time. So now a big part of our company is the consulting as well. So you would join IDOC, and in addition to getting a lot of great deals on purchases that you had to make, there's also tons of educational opportunities, but the consulting is a pretty big part of what we do as well. You have access to whether it's finance, HR, marketing, operations, efficiency. I'm forgetting a few there, but you have this all in-house on the consulting side.
So let's get back to what you actually do and what you've done. You've had a chance to be a consultant to hundreds of medical practices. across the country, and that's where you can really add the value in this podcast for our listeners. You've had the chance to observe how dozens or hundreds of practices went over the top and became ultra successful, and how some just sort of held in a holding pattern, perhaps for many years. What do you think was the difference between the ones that went over the top and the ones that sort of just treaded water for years?
Mm-hmm. Yeah, it's a great question. And it's actually one that I love stuff like that because I love to observe in terms of when I observe successful practices, when I observe unsuccessful practices. I like to see what are the core, what are the similarities, what are the commonalities. And I ask the owners as well, but I'll tell you two things that come to mind right off the bat. One is the customer service. And that's a key component, especially in eye care, because there is a retail component to it.
Mm-hmm.
So really understanding what it takes to deliver that high level of customer service, we'll almost always find in the successful practices. Nobody's perfect, but they're always working hard to build that into the model. The other one I would say is just having a vision, leadership. I spend a lot of time talking about leadership. When it's not there, then you lose a lot of the things that are necessary to drive change. I mean, management is one thing, but in a lot of cases, manager is about structure and stability. Leadership's about vision and change. And that's where a lot of practices lack. But the ones that keep moving forward with it have someone in a position of leadership that's basically has clarity around where they want to get to and is able to kind of take that team and bring them toward that vision. So that's an area I really like, an area I've really gravitated toward is trying to help a lot of these practices understand that and put that model in place.
So the managers are dotting I's and crossing T's and trying to master day to day, hour to hour operations, but the leader is executing that vision and maybe reevaluating it periodically.
Yeah, it's I think the younger generation may understand this a little bit better because they're coming up in a time and in this market where they understand that things change quickly.
Mm-hmm.
Now, if you go back far enough, there was a time, I don't know how far back we have to go, things didn't change very quickly, right? So you could just graduate, get your degree, hang a shingle, and you were probably okay. You probably didn't have to be real good with the business side of things or leadership or any of those components, and you would have done fine. There wasn't as much competition out there. There wasn't as much need for change. Nowadays, you understand this, things change quickly. And so you have to be able to adapt to that. You have to be nimble and willing to adjust your business model accordingly.
And so, yeah, when I was doing some prep for the podcast, you were talking a bit in your book, which we'll talk about being nimble and adapting to change, but also boldly executing the plan. I'd like to give our listeners some tips on what that means. What's the best way to go about boldly executing the vision and the plan and the business model?
Yeah. Well, that's such a big part of it as well, is the execution. Because we could talk strategy all day long, right, Keith? These are just ideas bouncing around in our head. It's something you wrote down on a cocktail napkin. Execution is really where the magic happens. And that's another thing that, when we look at practices, why do some continue to outperform the competition where others stagnate? A lot of it is that ability to actually execute on your ideas. I'm a pretty big fan, as far as leadership, of having that clarity both on long-term and short-term. Usually when I'll talk with a practice, especially one that's maybe not growing, I'll ask them what is your long-term vision? I'm not necessarily talking 10 years because I don't know what the world's going to look like in 10 years. Totally. Even if we just said 3 to 5 years, what's your vision? I'm asking for 2 reasons. 1, I want to know if you have a vision, what is it? So we can talk about that. 2, I just want to know if you have a vision. Mm-hmm. And a lot of times there's not one in place. So we get clear on that, but then breaking that down into, we have something at IDOC called what we call the IDOC 12-week goal. So really taking that longer term vision and then building shorter term goals around that align to that long-term vision and creating clarity around what are you going to focus on over that period of time. I think that's more likely to implement or at least for change to stick in the organization. And it's really just a process of better defining your goals and creating a model around it that people are actually going to, you create some urgency. I think that's one thing we saw in COVID was when there's urgency, people are more willing to act. So how do you take those longer term goals and make things more urgent? Well, you break them down into shorter goals. So that's something we work with a lot of our members on in terms of execution.
When we look back on 2020, the word or words that we describe it with will be chaotic change, swirling change, dizzying change. It's been just a wild ride this year. How much mental energy do you suggest that your clients who are trying to run the day-to-day operations and execute a long-term strategy, how much mental energy do you coach them to devote to staying on top of focusing on going with the change?
Yeah, it's a lot. And I've come to realize too that, they're more than business owners. They're people too, with lives and families and kids. And the business is a big part of who they are as a whole. So, I think what we've had to embrace with our model and with my model at IDOC is almost more of a holistic approach with consulting, is understanding that it's more than just the business. I want to know what are your goals in life as well, and how do those two combine? Because a lot of times what you find is that they don't have just business goals. When you really peel back the layers a little bit, they want maybe more financial freedom, more personal time, more vacations, things like that. Okay, let's have that conversation as well, because that ties in with what we're going to talk about pertaining to your business.
And that's such a great point, because we have a lot of clients who we talk internally about burnout, physician burnout, and this never ending treadmill that they're on of paperwork and just tiny details, 12 hours a day, and trying to find that work, life, family balance. Do you coach your folks on that?
Yeah, absolutely. I mean, we've had something that we've referred to, as long as I can recall, it's called the CEO model, where we really look at and that's such a big part of what we do. Honestly, that's a big part of why people hire consultants. They never tell you that in the beginning. It's always something more business oriented, like I want to lower my cost of goods, or I need help hiring an office manager. But when that relationship develops a little bit more, you start to hear things like wanting more, more personal time and things like that. So, we've always worked up what we call the CEO model, which let's get you out of that daily grind of your practice. And it comes back to leadership. Let's better train the people, make sure you have clear expectations, but let's put you in a position where you're actually operating as the CEO of the practice, not the manager, not the frontline workers, but the CEO. And if you're able to do that, then you can start to scale yourself, and life suddenly becomes a little easier, and hopefully a lot easier over time.
Good deal. The medical industry is going to continue to change somewhat rapidly in the next few years. Can you give our listeners maybe 3 talking points about how they can remain nimble and how they can sort of remain flexible to go with the changes?
Yeah, I mean, I think the one, I guess I keep coming back to this, but I would say getting really clear on what the future looks like for you is always being aware of what's going on in that environment, understanding what you control and what you can't control, and working within that framework to say, okay, in the next year or the next 3 years, here's what we're shooting for. Your team is such a big part of it. In your team, in terms of them having clarity on what their roles and responsibilities are, and also bringing them into the fold and making them feel like they're a part of the effort moving forward. And I think it's just a belief in yourself too. Fear is a major obstacle toward people moving forward. So I think when you've got the first two right, when you've got a clear vision and when you've got a good team around you, you have more confidence to invest in yourself and that piece of technology or that additional training to keep things moving forward. And you're going to have days where it's scary, but I think the alternative to that in a industry that's changing rapidly is you probably are going to stand still. And if you're standing still these days, you're just going to get past.
And I love your point about fear. I guess the little tidbit I would offer there is make sure that the passion in your heart and in your vision outweighs the fear, so you can keep moving forward, right?
Yeah. I will ask a lot of times when people ask about what should my model look like, or we have different areas of specialty within eye care, like sports vision or vision therapy. Should I go down that road? And honestly, Keith, a lot of times the first thing I'll ask is that interesting to you? And if they don't expect that question, but what I've seen in people that are successful, if they go off into a certain area of eye care, let's say sports vision, is they're really passionate about sports vision. Yeah. And you can't fake that. And so I think that's the fuel. And if you don't have that, I think you're going to burn out a lot quicker and probably not see it through to its completion.
Good deal. So let's switch gears a little bit. You do a lot of talks, you do a lot of keynote speeches and seminars and probably webinars now as a consultant, but you're
Yes.
also an author, and your fourth book is about to come out in July. Give us the title of the book and why you wrote it.
Sure. Yeah. It's I've been working on this for about 2 years, and it's called Prescribing Change: How to Make Connections, Influence Decisions, and Get Patients to Buy into Change.
Mhm.
The premise of the book is this: what we're seeing in eye care and certainly within the medical field as well is that doctors are and have always been, I think, pretty good at educating people. We have a lot of knowledge, a lot of information, and we share that with patients. What research shows is over the past several years, patients aren't doing what we want them to do nearly as much. As a nation, we continue to not take our doctor's advice to lose weight, control our diabetes, when it comes to smoking, when it comes to cholesterol. We don't change our eating habits, sleeping habits, drinking. In eye care, it's taking your contacts out at night, coming back for frequent exams. We're giving people the information, but they're not acting on it. So what I really did was spent a lot of time studying the science behind. A lot of it is based on neuroscience, behavioral psychology. How do we actually get people to act on the information? And as a clinician, you can educate people all day long till you're blue in the face. But if
Right.
people don't do what you're asking them to do, how impactful really are you in changing people's lives? So that's what I wanted to better understand and share with others, is how do you do that in a way that gets people to understand what you want them to do and actually act on it in ways that improves their, in our case, vision or just overall their health or quality of life.
And one of the main points that you're trying to make in the book is that doctors have to essentially sell
Mm-hmm.
their patients on
Right.
making changes. And you're not selling them a medical device, you're selling them in a convincing way to try to get them to actually do what you're saying. Talk to us a little bit about that, selling it from a perspective of essentially convincing them to do what
Mm-hmm.
you're suggesting.
Yeah. So it's a little delicate in my field because we do have that retail component, but doctors don't like to be, they don't like the word sell. It
Right.
just, they feel like it's too retail. So I'm just going to punt. And I understand, I get that. So the original title of the book was going to be Even Doctors Are Salespeople. And I just couldn't get past the point of thinking that's going to irritate some people. So
Yeah.
I did change it. I guess I'm glad I did. It wasn't a book on selling, and it never really was, but it is a book on how to be more influential with
Mhm.
people and how to sell them on change in terms of what they need to do differently. Our field's a little bit different in optometry because we actually do sell medical products. So there is that component of it.
Mhm.
But the wider objective of the book was really to understand and even really lean on some of the principles in the world of selling and people that are good at it. People that are good at selling aren't twisting, manipulating people in making them buy and do things they don't want to do. Some do, but you'll get short-term success out of that.
Yeah.
Usually the ones who are good at it, they're very curious. They want to know about you. They want to understand your pain points. They actually care about helping you. They make good presentations. They better understand you. They're able to effectively listen to objections and give you the information in return that will help you make the best decision. So I did apply some of that in the book, but I think absolutely we're in a time where even in a healthcare standpoint, you have to be able to sell people on change in a way that they understand how it benefits them.
And I imagine this has to be one of the single most frustrating things about being a physician. And I'm sure our listeners who are doctors are nodding their heads right now. You've seen this patient 10 times, and 10 times you've told them what they need to do, and they come back on the 11th visit and they haven't done it.
Yeah,
So
yeah.
what are some takeaways you can give to our doctors about connecting better with the patient, trying to influence them better in a
Mhm.
conversation, educational way? I know these are some of the things you talk about in the book.
Yeah. And, really the last chapter leans into that very topic, that you've done all these other things, that you've asked the right questions. You've taken a spirit of curiosity to learn about them. I talk in a lot in the book about how to improve presentation skills and how to really connect with people in a way that they understand the value. When you get the patient that you just described, that's an area I really lean into in the last chapter called motivational interviewing. It's basically about better understanding what's most important to them and their motivations for wanting to change. And there's a whole science on that, and it's fascinating, but it really requires doctors to do something sometimes they're not all that comfortable with, and that's give up control. Now, that doesn't mean fully give up control of the outcome, but it means understanding that they don't have to do what you're telling them to do. Could you terminate an employee who's not compliant? Yeah, you can, but I think we can agree that's not really benefiting anybody. Would it be better if we could actually get them to change based on their own motivations? So just a quick example would be asking somebody to quantify their desire to change something. And let's say, Keith, you were diabetic and we needed you to lose 30 pounds. And I said, Keith, on a scale from 1 to 10, what's your, 10 being you have a high desire to do this and 1 being not at all, where do you rank yourself in terms of your willingness and motivation to start eating better and exercising? Now, we've had this conversation 10 times, Keith. So you say a 3. I'm going to be honest with you, it's a 3. I say, okay. Now, some clinicians might take a defensive posture there and say, well, why isn't this more important to you? We've talked about this, Keith. Come on, you need to take your health more serious. Motivational interviewing is more of an understanding and guiding style. And I might reply to that because you picked a low number and saying, Keith, that's fine. Why didn't you pick a 2? Mm-hmm. Oh, now, all of a sudden, you have to start giving me your own intrinsic reasons for not picking a lower number. And all of a sudden you start vocalizing your reasons for potentially wanting to change. And we get a conversation going that actually causes you to open up your reasons, your motivations, your desires for starting to change. And from that, a conversation develops more around what's important to you.
So the book sort of digs down on this art of taking a patient and from having them only hearing information that you present to them to actually acting upon it so that you can work with them to achieve the goals you have for them.
Yeah, that's it. It's just getting past that point where I hear the frustration so much in my own field and other doctors as well, is that patients just they don't take what we say serious. They don't do it. They don't care. I don't think that's really true. So I really challenged that from the beginning and really dug into the science behind it is how do you get people to change? How do you get people to act on the information? So that was really, you summed it up there. My objective of the book was to make clinicians more impactful with patients by getting them to go beyond just hearing the information, but actually acting on the information.
And it's interesting for our listeners that are saying, I might pick that book up. It's not all clinically focused. There's a lot of human psychology you've put into this book.
Yeah, I mean, it really would apply to, a lot of it would apply to other scenarios as well. If you're looking for, if you have a staff or a team and you're looking to implement change there with your kids, I don't claim to be an expert on child psychology, but I mean, some of these philosophies and strategies are universal. But yeah, I really leaned into the science and research behind all this. So it's not just my opinion. I really wanted to better understand what the science has to say about behavior change and how can doctors embrace some of these things, apply it in their own approach with patients and get patients to change as well. And that makes you more effective, one, as a clinician. You'll be more successful as a clinician when you have happier, healthier patients. And if you do own a practice where you are the owner and part of the success of your practice depends on the success of your patients, then there's a financial component to that as well.
Interesting. So let's talk a little bit more about the future, because the healthcare industry and the medical sector are just going to continue to change rapidly in the next few years. How far out are you looking? Is it a 5-year mark that you're trying to come up with a game plan for your clients? And what do you suggest to them? Are you suggesting they come up with a 5-year plan?
Yeah. So we work within, I wish my crystal ball went much farther than 5 years, but again, it's the same conversation around change. So it's hard for me to, I don't think there's anything wrong with having a 10-year plan. It's too far out for me to really get any clarity on. So we have something at IDOC we call a 3-year growth plan. I got no problem with 5 years, but in that time range, and that's what I'd actually consider more of the long term, where we really look at where you're at now and put together a plan. In our case, with the 3-year growth plan, where do you want to get within that 3 years? From that, we have a better understanding of what is your vision, what is your goals, what are you passionate about, what are your interests, and let's get something going here that gets you excited to get out of bed, that you can see, right? Clear vision. And then that's when we start working on the shorter term goals. What are we really going to focus on over this next 12 weeks or this next quarter that we're actually going to execute? Not just talk about, not just strategize, not just come up with ideas, but actually get you and your team to execute on these. Most successful practices I've seen have gotten there through baby steps. These are small businesses, and it's not overnight success, but they're constantly improving the practice and implementing new ideas, but it's not necessarily, when you look at a practice and say, wow, that's a, multi-million-dollar practice over there. Yeah, it took them a long time to get there, but they did the things they needed to do over time.
And they did it consistently.
And they made mistakes, and not everything worked, but they took risks along the way. They kept learning from it, and they kept getting better. It's like I tell my kids in sports, nobody's looking at you to be perfect, but the only way to get better is keep working at it. And I've, shown them that life is like this, but, eventually if you keep pushing, you'll, that arrow will, in the long run, point upward for you.
So let's talk just for a second about implementing new technologies as the healthcare sector continues to evolve. What are some takeaways you can give our listeners about the importance of implementing new technologies?
Yeah, well, I think you have to do it within the framework of your finances, but it should always be something on the mind of, again, in my case, working with optometrists, maybe setting aside, maybe it's one new piece of technology a year and keeping up with that component, that high end, that high tech market. What technology you should invest in really is more unique to that practice in terms of what does it align with your overall business model? Is it something that puts you closer to that longer term vision? What does it improve? I mean, some technology is nice to have, where others you can really look at it and see a strong return on investment, or this could significantly improve efficiency in the practice, or it has a lot of wow factor with patients. So we weigh a lot of those things, but yeah, pretty bullish on not overdoing it with too much technology at once. If you got to look at the financial side of that, but constantly updating the practice and looking at where do we need to invest money, and then kind of having that money set aside for those things.
Cost versus benefit. So,
right.
Dr. Vargo, how can our listeners find out more about you and about the book, which will be out in July?
So, you could go to Dr. Steve Vargo, Dr. Steve V as in Victor, ARGO.com, and learn more about me there. The company I work for is IDOC.net, IDOC.net. And the book will be out July 14th, and that is on Amazon. So if you just search out Prescribing Change, it should pop up on Amazon.
All right. Well, I want to thank you for joining us today on the Doctor Marketing Tips podcast. You've given us some great insights from your consulting world and your experience on helping our listeners and our medical practice managers be more efficient, and executing on those strategies, I think, is the big takeaway.
Yeah, Keith, I think that's a big part of it as well. Just making sure that you take those ideas and have a dream. I mean, have something you're passionate about, something you're excited about, and then just making the decisions around what do I need to do? What do I need to act on? That's a big part of the book, is getting people to change. But if you own a practice, if you're a clinician, you want to be more successful in that area, just keep pushing forward with all of that. Keep acting on it.
Great advice. Dr. Vargo, thank you so much for your time.
Thank you, Keith. I appreciate it.